everyone, my name is Dr. Labate and I am the founder and executive director of the Chacruna Institute for Psychedelic Plant Medicines. From our very beginnings, we at Chacruna have made it a central part of our mission to empower marginalized voices in the psychedelic community, including women, queer people, people of color, indigenous people, and the global south. We have been unique in this endeavor, working within a psychedelic landscape with a worrying lack of diverse representation. Now, more than ever, given the current social and political climate, the active fostering of diversity, equity, and access is critical to the future of psychedelic medicine. Hello, everybody. Welcome to the World Psychedelics Day exciting panel on queering psychedelics. My name is Labate, and I'm speaking to you from Ohlone Territory, Bay Area, in San Francisco, California, and it's a pleasure to be here. I bet some of you are wondering what the hell is this World Psychedelics Day? Well, this is an initiative coming from our brothers and sisters in the North, in Canada, just feeling a lot of respect for psychedelics and all the healings and blessings that so many of us have received in our personal journeys with psychedelics on the one side, and on the other side, the huge amount of stigma that still exists, the illegality, the persecution, the irrationality of the drug war, and the fact that this important cultural phenomena is really still largely misrepresented and not present as a cultural manifestation in different areas of life and society. So this event is trying to bridge this gap. Organizers are as hopeful and wondering if maybe even one day the UN could get this day recognized. I am particularly happy that they included the topic of queer people and queer issues in this day, because it's not just about celebrating psychedelics per se, but also understanding the needs and specificities of minorities and what these minorities can bring to this mix and how these minorities can benefit, but also what are their specific needs and so forth. So the Chacruna Institute for Psychedelic Plant Medicines is a sponsor of this panel, and we're also kind of celebrating 2 years from our inaugural event, which was Queering Psychedelics, that happened in June 2019 in the Bay Area. And all the speakers here were part of that initiative. Clancy and Alex are also part of the Chacruna Institute, and Kevon is a dear collaborator and friend for many years. So I would like to pass the word to my colleagues and ask each one of you to introduce yourselves and say a little bit what brought you here, what caught your attention in the world of psychedelics, and what is it that you do. Give a little intro to you, starting with Clancy Cavnar.
Good afternoon and happy Pride Month to everybody. I first got into psychedelics when I was in high school, when I took a lot of LSD, but then I took a lot of drugs, and then I stopped taking drugs altogether. Then 7 years passed, and I met Santa Daime when I was working at a children's home in San Francisco, and my coworker was going to the California Institute of Indical Studies, and he invited me to go to a ceremony they were doing for the students there, not at the school, but in a place in the Haight. And then I got involved in Santa Daime, and after that, it inspired me in many ways, and I went back to school to get my doctorate, and I did my dissertation on gay people and ayahuasca, and then that caused me to get more deeply involved in psychedelics and more deeply involved in stuff Bia was doing, and ended up in Chacruna. That's the whole story of that.
Thank you, Clancy. Dr. Alex Belser.
Hi, everybody. My name is Alex Belser. I'm coming to you from the unceded Duwamish lands of Seattle. It's now called Seattle in Washington State. Happy Pride Month. It's June. We've arrived. I got interested in psychedelics in the late 90s in college when a friend handed me Stan Grof's book, LSD Psychotherapy, which is still a classic and really an incredible introduction to the topic of psychedelic-assisted psychotherapy. And I later went on, like Clancy, to become a psychologist and to do clinical research with psychedelics. I also, as a queer person, and was coming out at the time, and in my freshman year of college, I had come from a high school where there were 3,000 students and not a single person was out of the closet. It was really a highly homophobic, transphobic environment. And, the gay club dance scene and the 90s queer rave scene was using their medicines were not really alcohol. There was a lot of MDMA and psychedelic use happening at the time. And I think that was informative for my trajectory. And I get to work with different medicines, doing research with psilocybin at New York University starting in 2005 to treat depression and anxiety and people with cancer and people with alcohol use disorder, and even working with healthy, normal people who are priests and religious leaders and clerics and imams and Zen teachers. And later, when I finished my doctorate, working at Yale on psilocybin trials to treat depression and obsessive compulsive disorder. And I'm now the chief clinical officer for Cybin, which is an organization that we're working to bring psychedelic medicines through the clinic and to the FDA for review to treat depression and alcohol use disorder. And I get to be a volunteer for Chacruna, advising and helping out with a variety of things. I'm working with Dr. Clancy Cavnar and Dr. Bia Labate here on a book called Queering Psychedelics, an edited volume of dozens of incredible chapters looking at the intersections of queer identities and psychedelic consciousness, culture, and medicine. And I think it will be an incredible set of contributions, and we're looking forward to sharing that. And I also have a small private practice where I focus on working with queer folks and on psychedelic issues. So there's a little bit of an overlap in my psychotherapy clinical work. So it's great to be here with you all today.
Thanks, Alex. And our dear Kevon.
Hi. Well, first I want to say a special thank you to Dr. Clancy and to Bia for being the first people to ever give me a platform on speaking on such matters. I am Behike, Sensei Kevon, and I am on Labate territory here in New York City. What brings me to psychedelics is just my own POC or BIPOC, BIPOC POC, traumatized, generationally traumatized heart, and wanting to alleviate some of the pains that I know personally in my community. So that began, reading Carlos Castaneda, the Art of Dreaming or something like that, one of those throwback books, and very, very carefully listening beyond that plane that we all hear the whisper through. And it just said, it's time for the mushrooms. And I didn't really have much of a understanding of what they were when that whispering began, but that whispering turned into me waking up. I think it's important to share this part because now I'm very ceremonial, right? And people know me for being this kind of like serious medicine person. But my introductions back when I was hearing the whisper was a dance party in New York City with a bunch of people just throwing powder on the floor and dancing around, and where I decided to date my little gay DJ boyfriend, and he was one of the people who introduced it to me first. I don't really share that because it wasn't in ceremony, it wasn't in the right context where I was being taken care of, but it was the first feeding of my mind and spirit, so to speak. Then fast forward a few years later, a friend of mine was growing, and I won't share any names because, legal issues, but a friend of mine was growing, and we had a history of meditating together. And that was my first time having a heroic journey in a New York City Bronx apartment in the hood, where that's not usually what you think of when you think of plant medicine awakening and stepping on the path. And that later on led to me being a part of things that I don't even know how I'm a part of them, such as this event, World Psychedelics Day. I'm honored and I'm overjoyed, and I had no idea what the gravity of what this could be, but I'm honored to be here.
Thanks, Kevon. Just maybe for those folks who doesn't know, can you say what is a heroic journey?
Well, for folks who don't know what a heroic journey is, I've changed whatever it was. It used to be 5 grams, but I think an actual heroic journey, to be considered as such, it needs to be 7 grams or 10. It needs to be approaching there, because people are having 5 grams is getting your foot in the water for the level of work that needs to be done for people to feel alleviated from their traumas in this day and age. 5 grams is just like, I mean, Terrence McKenna made it popular, but that's just like getting your feet wet, whereas the 7 to 10 gram range is like hold on to the rails. And from there, one can awaken deeper into their shamanic or healer or provider calling, if you will.
Okay, people, don't go run to get your 5 grams. Sit down, watch the panel. That's not what we're trying to convey here, but some personal stories that might illustrate paths of how we came to be where we are right now. So I want to go and start talking about the specifics of why we're here today with a question for all of you, and I'll just follow the same order. Um, are there special reasons LGBTQIA folks might be particularly benefit from the use of psychedelics? Or can you give maybe some examples on you see how queer people, LGBTQ, whatever you want to call these populations, can benefit for working with these plants? Do you know stories, first case experience? And let's follow the same order.
The subject that I chose for my dissertation was identity and people who are gay, and what they get out of those experiences. And I think that the stories that I heard specifically from people who abandon internalized homophobia were the ones that I think were really made my point that psychedelics can be good for, or ayahuasca in particular can be good for gay people to take when they're feeling bad about their identity, because ayahuasca has the ability to show people who they really are, and everybody is really a piece of divinity. And for people to see that who are gay, have been told that they're defective, is very transformative. So the examples that I heard were stories of people who felt terribly about themselves and then realized they were, had a mission on earth and were sacred beings. And those are the biggest changes that I think that psychedelics can give to gay people.
What about yourself? Did ayahuasca help you with your own identity?
Yeah, I had a lot of different changes because of Santo Daime being a Christian religion that I joined, which has been my main route of taking psychedelics. But the reason that I even had the idea to do my dissertation was realizing that, like, when I took ayahuasca, I felt great about myself and who I was and all aspects of myself, including my sexual orientation. And I was just wondering, like, don't all gay people feel that? Like, are there gay people who drink it and then go, now I realize I'm a terrible person. I just couldn't imagine that. So for me, I was pretty accepting of myself. It didn't really change that aspect of, like, I thought it was okay to be a lesbian by the time I drank ayahuasca, but it changed other ways of my own, like, self-acceptance that were more important to me. But to some people, like, rejecting their sexual orientation is a really big, major block in their life.
Thank you. Thanks for sharing. Alex.
Well, I mean, just to summarize what I think people here know, we know that we live in a homophobic and transphobic world, in so many ways, in so many nested ways in our cultures. And we know that kids, I'll speak to sort of at least my basic training with the exposure that kids in America have faced across generations, where they have literally thousands or tens of thousands of messages that lesbian, gay, bi, trans folks are weird, wrong, bad, immoral, shameful, sinful. They have overt high levels of discrimination. They get the message oftentimes in their families of origin with their people who raised them or their siblings. They get it in their neighborhoods. They certainly get it in their schools. We see that time and time again with Glissan's work on school climate surveys. They get it from their peers and in locker rooms and from teachers. They get it in their places of worship, that being gay is wrong or sinful. They get it from their local, state, national governments, that it's illegal to be gay or trans. They get it from medical authorities. They get it in the current, what we call culture war, but honestly, it's just outright transphobic oppression regarding trans kids' ability to play sports in schools. And so all of these external processes lead to severe clinical experiences, identity issues. This is documented through Ilan Meyer's work on minority stress, which was developed mainly around being gay, but also I think is adopted to other can be adapted to other positions where there are very specific, in addition to how hard it is to be a human in this world, queer folks have an additional level, including people who have intersectional identities because of BIPOC, their immigration status, because of their class status, because of other intersecting ways in which they do not have the same social location privileges that I may have, for example, that these cause actual additional stressors and they lead to bad outcomes. So those bad outcomes include, for queer folks, 2 to 5 times the rate of suicidality, alcohol abuse, higher rates of depression, higher rates of anxiety, higher rates of post-traumatic stress, higher rates of school victimization, higher rates of reported harassment, higher rates of sexual victimization than their straight, heterosexual, cisgender counterparts. And so there are unique additional stressors, and we actually have cortisol evidence. When you actually look at queer folks and take cortisol samples, they have more stress through biomarkers. And part of my work, so I did my dissertation on preventing suicide amongst gay, lesbian, and bi kids, adolescents, where there's this hugely disproportional level of suicide. And just looking at that, and I think that for psychedelics, the question is, could psychedelics help alleviate not just general traumas, but LGBTQIA plus specific trauma? And I think the answer is, anecdotally, the answer is yes, because I've talked with many and I've treated many clients who take psychedelics or have taken psychedelics and awakened to ways in which they could be healed. I mean, Clancy's work on self-acceptance and identity has been, I think, really formative. And I see that sort of story time and time again. I'm working currently with a young trans person who is going through a lot of stuff that has to do with their queer and gender identity, and going through a lot of stuff that has to do with childhood, family stuff that's maybe not specifically related to this. And they're treating themselves with psychedelic medicine. They're treating themselves with microdosing and moderate dosing of medicine, and trying to do so in a harm reduction way with better practices. And they've been through the ringer, and I got to tell you, the work that I've witnessed and in some ways helped with has shown that they have had awakening experiences with psychedelics that have helped them realize that it is not them who is fucked up, but it's the world that is fucked up. It has been really, pardon my language, but it has been really violent and terrible, and continues to be so in their places of work and other environments where they're misgendered all the time, where their pronouns are used wrong, where their name isn't used, their old name is used. And I think that the psychedelic experience can help awaken us to the deep truth of things, even if that truth is not always welcome, but it can take the blame and the shame and the stigma off of the shoulders of the queer person and realize, actually, we need to look at the deeper understanding of what's really happening here. And that points to systemic victimization and violence. And it's not pretty. And sometimes we need allyship amongst each other to help support each other with that. But it is true. And I think that the psychedelic psychedelic processes can really awaken us to that in a very deep way, and that can be destigmatizing, de-shaming ways to generate self-compassion, to generate a deep understanding of who we are. And so the people who harbor internalized homophobia and are like in the closet or STR8 straight, they start to realize that they don't necessarily have to live in fear. And sometimes I think psychedelics cause us to have confrontations, profound confrontations with ourselves. And if they're well supported, and I mean that they have a good community or a circle or a facilitator or a therapist, and hopefully in legal settings where we don't have to live in a prohibitionist world, I think that can lead to not only good outcomes, but like really radically healing outcomes and trajectories for people. And I think that psychedelic medicine could be a specific cure for a lot of the transphobic and homophobic cultural violence that is perpetrated on queer folks.
Beautiful. It's always such a pleasure to hear you when you get in your element talking about the issues that you know best. And I agree with you. And I also think that having leaders like you and this panel and this initiative also help create that, because it's not just that it happens magically. You took the psychedelics, but creating this culture and believing in the power of psychedelics to help, I think also helps uh, achieving this outcome. So I think it's important that people watch and encourage people that have such issues, or relatives or friends that have similar issues, to watch this panel and think about it, because it's also, you have to have faith that this can help you and believing that this can be a way to find this healing. I think is part of why it's important to have these conversations. And want to pass the word to Kevon.
Here I am as a queer Black male, first generation immigrant from Jamaican parents, and I'm a part of this really amazing thing once again. And I keep finding myself in positions where I'm one of the first, or in that group of people who are the trailblazers and so on. And I watch what happens when someone is not in a body that has such limitations, and it hurts. So, for example, because of the current legal situation, I'm not able to really fully speak about what my grassroots mission has been in the BIPOC community, and how it is that I'm educating people on the fact that spores are legal and grow kits are legal. And that's all I'll say. But I can't speak more on what my mission is. How it directly affects me as a gay male. What's happening right now due to COVID, due to the increased stresses in our collective environment, it's just getting very much more dangerous and much more risky. People are doing much harder drugs without knowing that things like psilocybin and even a different use of K, even a different use of MDMA would be a little bit more beneficial than what they are potentially about to overdose with. So, I mean, it really hit me in the head when I sent out my ceremony questionnaire to what is mostly I serve mostly straight people, and I sent out my questionnaire and the mental health assessment. That's what I sent out, and the questionnaire, and their mental health assessment came back less cuckoo than my own. I was the one with more of the manic episodes and so on. Being a first responder, so to speak, in terms of people's emotional turmoil in a medicine person's position. Where's the help for that? Where is the community for that? Where's the building facility? Where's that is not, a room in my apartment that I call the church side? So, I mean, there's more that I want to share as I look around the space and I see what's possible here. So that's all I can say for now.
Well, we don't have to answer everything now, because we also believe that this panel is just planting seeds that will grow in many other countries and other forums and other circles. And, the conversation is an ongoing one. I want to make a bit of a different, invert the question, and it's a little provocation. I'm drawing from a chapter in our book that we published recently, Ayahuasca, Healing and Science, That was a continuation of our previous, the therapeutic use of ayahuasca. And some people were wondering if, for example, when you have levels of trauma that are so big and so strong, let's say PTSD, for example, uh, if you could take ayahuasca, it could end up having like a different effect, to have that confrontation be so powerful and so overwhelming that it could potentially be more traumatizing. Um, so I wonder if you think that there are cases of people um, that might have suffered so much trauma and have such a big challenge with this topic, that a confrontation with this within the space of a healing process could be maybe too much, and could end up like creating a harder or more challenging situation. And I know this is a difficult question. I'll leave it up for anybody that wants to comment.
I think there's people who have mental health problems that shouldn't take ayahuasca, and those people have mania or they have psychotic disorders. But people who have trauma, I mean, there's ways to take smaller doses of ayahuasca, for example, to not do a huge amount that would mitigate someone re-traumatizing themselves by having an out of control experience. So, I mean, and also just to confess that I am in Santo Daime, which kind of believes that ayahuasca can heal everything, or that everything can be healed, I should say. So I think that's an exaggeration of saying, yes, I guess someone could be given, I know people can be given too much LSD and be permanently damaged or something like that, but just because someone has trauma, like that's the thing that needs to get healed, and maybe not go in with a jackhammer, but I think it still would be beneficial for people for whom it's not, counterindicated.
Thank you.
I'll just add that, especially I think that in the psychedelic community, we have a lot to learn from the queer communities that have come before us. And one of those is that when we conceptualize, I mean, this is not just from the queer communities, but when we conceptualize trauma, it's not something that resides like in my body or in my memory or my personal autobiographical, atomistic, individualistic experience. And I know that the people here, I think similarly, but we're dealing with collective traumas, internisted, transcultural, multi-generational, transpersonal trauma, in the sense that the perpetrations of violence, for example, against queer folks or BIPOC are cultural traumas that we carry. And I think that psychotherapy and methods of healing, including psychedelic work, can be collective healings of those traumas. And I think there's lots of different ways of working. And I think that different levels of trauma require different practices. Like some people may not need lots of two therapists in a room, and they may not need a lot of extra work before and after, but some people may need like deeper levels of healing. And, even people who are, in all of the early registered clinical trials that have happened at universities, we exclude, as Clancy's pointed out, and I think this is true in a lot of the ayahuasca practices, but exclude people who are psychotic or have what are called thought disorders, or people who have predisposition towards mania. But it's possible that psychedelics could be helpful for those individuals as well. They could also be harmful in some instances. When I say possible, I mean that we don't know, and we don't know what sort of practices could be useful. And specifically, I don't think that the healing happens just in the medicine. I think the medicine held in community, held in concert with your therapist or your circle or whatever the supportive practice is actually where the trajectory of healing can happen. And some people may just need a deeper level of healing. These traumas came into being over generations and centuries and years of our personal lives, and I don't think they're necessarily going to be unwrapped overnight in a single session. And so we may have to think like really deeply about what our processes of healing might look like.
when dealing with people who have multiple layers of traumas, where myself personally, I can have a whole list of them, right? And each person's trauma, you want to think of like another body or another person coming into ceremony. So the easier way is to chip away at each of those bodies over time, and to also make sure that you yourself as a facilitator, healer, onanya, shaman, whatever your word is that you have gone through enough of what is traumatic to you. And the person who is serving the person who has complex PTSD needs to have gone through their own levels of such things in order to vibrationally be a match of healing release for that person in that space.
Clancy, you have written, Clancy, about conversion therapy and this idea that in the past you could give psychedelics to cure gay people. Some past that it's not so, we don't really know and don't talk a lot about it. Can you share with folks a little bit about that?
Sure. I was doing research for my dissertation, and I was kind of horrified to discover a history of scientists using psychedelics and psychologists using psychedelics to try to influence people's gender, sexual orientation. Starting with, not starting with, I don't know what the first ones are. And actually, I know Alex has a pretty good history of that for things that I might leave out, but giving peyote or giving ayahuasca to gay men, and then it just shows how the culture influences what the results are going to be, because the results of these experiments that were performed were often that they found them to be successful, that they were successful in changing gay men into straight men. But I'm sure that they were not successful, and they were just conforming to the therapist's expectations. The therapists were noting that the men had deeper voices or had more masculine stances when they stood, or observations like that. They were so colored, and the danger of like thinking that using things that are really designed to heal in order to try to twist people's perceptions of themselves. I'm sure that I'm correct in saying that nobody's sexual orientation was actually changed as a result of taking psychedelics. And also that goes back to some of the stuff that I've written before on Santo Daime being the ayahuasca religions of Brazil, trying to use ayahuasca to help people change their sexual orientation and become straight and become family people and conform into this ideal that, you know, it's an ideal for straight people, but gay people have their own ideals. So I think the conversion therapy that used psychedelics, it's ended when, I mean, the therapy using psychedelics and the conversion therapy is still being practiced in different states in the United States. So I really hope that does not have any kind of renaissance and people thinking that is ever a successful project.
Yeah, thanks for addressing this complicated issue. And in Brazil, there is a lot of backlashes now with the current administration of Bolsonaro, and also some really strong patriarchy that exists in the universe of ayahuasca religions. And we have stepped down in Chacruna to really point this homophobic, domination tendencies that exists within some ayahuasca circles, transphobic, and a lot of hatred, really, and giving ayahuasca to people and trying to tell them that they have to constitute a standard family of a man and a woman and a child and so forth. It's really violent and it's a big taboo, and people don't speak about it. Also, I have engaged in different controversies with a retreat center in Peru called Taquiwazi, where the leader Jacques Mabi has also expressed very homophobic views. And it's really delicate and up to us to speak out against this. And it's a kind of fine line between being an academic researcher and an activist, because I do really think that it's part of your ethics as a researcher to stand up in solidarity with the people you study. So if you're focused on these minorities, you really have to support, uh, you know, like if you're engaged in study indigenous people, you're going to uh, support indigenous land rights. And if you're studying Afro religion in Brazil, you're going to speak out against racism. And so it's a kind of, there isn't a line that separates, where is my activist self and where is my researcher. It's all comes together. I know Alex has a lot of knowledge on this, but he has a lot of knowledge on a lot of topics. So I want to explore another one with him, which is you wrote about this idea that we maybe should question the binary, have a mommy and a daddy kind of archetypical figures as therapists in clinical trials. This was created supposedly to be progressive, to not have just a man, two men or two women, but to create a balance. And some people like yourself have challenged that. Can you explain the story and why did you write about this?
Yeah, happily. Well, not so happily. It's another sort of dark topic, I think. I found, even currently, in allegedly like highly educated, formally educated circles of professionals, that they think it's really essential that in the room, if you're going to do dyadic therapy, which is a standard model, you have two therapists in the room with one person taking psilocybin or MDMA, that they should be a man and a woman. And I think that I want to make the best case for it, but it's difficult to discuss in a way that isn't without. I think it's important to look at the underlying framework for what motivates that. There was a history potentially of sexual abuse happening in the room, and so one of the rationales is that we should have a woman there because the man is so potentially dangerous that we need to protect the patient against that, and so we're going to put a woman in the room as well to prevent sexual transgressions, which I think essentializes like male aggression in a highly stereotypical way. And then you have this male-female dyad where there's this idea that the man potentially has like solar, fatherly, in the analytic tradition, good daddy, masculine, yang, archetypal, stereotypical gender, contributions. And the woman has lunar, feminine, motherly, mommy, nurturing, stereotypical gender, womanly stereotype sort of contributions in the space, and that sort of an archetypal balance provides the ideal or optimal clinical milieu for healing to occur. And the problem with this, well, there's so many problems with this, but first of all, it essentializes gender. It completely ignores diverse gender backgrounds and situates it entirely into a cisgender female and male. It essentializes highly stereotypical understandings of what constitutes like male energy and female energy, ignoring the fact that as a male provider, I mean, I'm a cisgender queer male provider in the room, but like the stereotypical feminine qualities, which we can just see as like compassion, understanding, receptivity, listening, these sort of, again, stereotypical qualities can be evinced by all genders. All gendered people can bring these into the room, and in fact, frequently do. We know that there's a lot of good research on this. And so this is a sort of like heteronormative, transphobic, baked in, highly gendered, totalizing assumptions about like what constitutes like the best psychedelic psychotherapy. And so I and others who've led the way have said this doesn't make any sense. At our trials at NYU, Jeff Gus from the get-go was like, we're not going to do this like retrograde gender thing. If we're going to have two therapists in the room, they can be of different or multiple genders. And so we've had male clinicians, we've had female clinicians, we've had people with different pronouns in the room. MAPS has moved to that model in their MDMA trials. Our trials at Cybin are all adopting a gender diverse therapy platform. And I think that other people are moving in that direction as well. The last thing I'll say is that it's important to have patient-centered or client-centered practice. So if an individual has a specific trauma, as many people do, where they were sexually abused or physically abused by somebody of a particular gender, which could be male, female, trans, or other, or diverse, that you have patient-specific approaches to that. Maybe that's not the person that you pair with a male-male therapist dyad if they had sexual abuse at the hands of a male perpetrator in their past. But that can be handled based upon the patient's specific needs, that you develop a therapy for who they are, what they come to you with, and come up with a treatment plan based around that, including the pairing of who they get to work with. But to bake it into a heteronormative practice has been really like terrible. And it builds on what Clancy was saying, just to go back to this terrible, highly heteronormative practices in psychedelics that, you know, Tim Leary said that LSD was a specific cure for homosexuality. You know, also at Harvard, Richard Alpert, who became Ram Dass, published 2 conversion therapy articles where he successfully said he converted gay men to be straight. There were a dozen queer people treated at Hollywood Hospital, which famously treated Cary Grant and was one of the most famous psychedelic hospitals of the 60s and 70s. There's published research now in Lancet Psychiatry about conversion therapy in the UK with lesbian women. I mean, this is like not something that happened as a marginal case. This was like a standard practice to give people psychedelics to make them straight. And now, like, we just see the vestiges of it in our current practices, where we don't ask people for their pronouns, we don't ask people for their names, we don't like actually talk about the differences of gender or sexual identity in the room when straight providers aren't acknowledging that level of privilege or thinking critically and reflexively about it. And some people are doing better and have been for a long time, and I think that we can do better, and we have to. I think that some people are really paving the way with that, and I've been learning from them, and I encourage every researcher and clinician out there to like really figure out how to like do this well, because I think otherwise we inadvertently even participate in systems of violence that we don't want to or need to propagate.
Totally. It's like people that say, oh, I don't see color, or I don't care for race. People that are denying that these things matter is generally because they are identified with the status quo and are in positions of power and privilege, and think that we don't have to talk about that, or that is divisiveness, or that is not important, is always coming from people that are not on the other side of the spectrum, suffering that oppression, suffering the being a minority. And I think, again, encouraging everybody to keep on talking and writing about it, promoting panels like this, and following a little bit the this discussion, Kevon, talking about you hold circles, and you've been in a lot of different ceremonies and rituals and different contexts, and it's kind of common in a lot of different settings to have this idea that there is an universal energy, and that energy is part feminine and part masculine, and a lot of different groups go by that idea, separating male and female and considering the divine feminine or the divine masculine. Do you think that this is problematic and maybe challenging for people that are gender queer or non-binary, or can we also live with those categories and it's okay?
I can't escape that there are these 2 energies flowing inside of me. And so anyone who comes into a ceremony space that I'm leading, they are already meeting those 2 forces flowing inside of me, the masculine and feminine. And I identify as two-spirit, or whatever. I made up a word in my own language for it so that no one feels like I'm taking their word. And I'll share that at another time. Himmer, him and her together, himmer. So as a himmer, shaman, onanya medicine person, I bring sometimes mother and father energy right to the person when they need it, shifting from one into the other, whatever's needed in that moment. What I have found, speaking on the MAPS model of man and woman as facilitator and patient baby, what I've found following that in a ceremonial context, where I've had another more like masculine dominant male and a more like I had a registered nurse, so she was a nurse. feminine by all the means that we would say, oh, someone is nurturing and caring, but she's also in her masculine side as well. But for lack of for saying it any other way, she was a nurse. So where I was tying those two energies together, they were both like extremes of those energies. And that I found to be the most healing group that I've ever had in my history of giving ceremony. Another example I'll share is using only men as facilitators, where one woman is receiving healing energy or healing support. So not making it be like, not picking three guys, but like having one that I chose to be my facilitator, and just having another participant. He just happened to be there and was male. And she shared that it was healing for her because it was her first time being among men that did not want to harm her. So although it could have had a triggering effect in another way, in this other way, she said that she needed to receive that masculine energy or male, cisgendered male energy in a space that wasn't trying to do the things that we know women come to spaces to be healed for. And that was a beautiful moment. So I think it's as unique as our fingerprints for what people need. And any specific way to do it is just, we're too soon in all of this for anyone to be picking, well, that is the way, because we're each so unique and it's so malleable, and we need to keep some of what's malleable in it and gently solidify different parts as we go along, and just hearing what's happening from both levels to see what can be done, because I'm able to work at a different speed because I don't have to go through all the red tape. So I can experiment with it. Well, that couple with that couple with 2 + 2 + 1, 1 + 3, and 3 × 4, and that changes how I do my next ceremony and what I understand about people and their needs. And again, what has worked the best is a queer facilitator, someone that's like that the world usually doesn't accept. So if I were to paint my perfect ceremony, it would be a trans woman, a trans man, a straight woman, and a straight man all together, singing different songs at different times in the space of maybe like 10 people. So only one person over the amount of facilitators that's in the room. I don't know. I don't know where that just came from, but you know, you can save that one. That's that.
Well, that just shows that there is a lot of room for creativity, and that we haven't really have this kinds of fantasizing and discussions about what we could do if we really wanted to apply scientific questions on gender and create different formats of rituals and then interview people and follow up. I mean, there is a whole potential of things that could be done if scientists were looking into the issue of gender. I think that's what comes up from me, from your invention, is that there's a lot of things that we haven't done because we haven't asked those questions, and that's, we're just starting, and it's just like looking underneath what's in there, and then there's a whole universe. And that's why I find it exciting to be celebrating queer people during Pride, sitting here in the Bay Area, whereas I myself also had a very long journey to come out of that closet that was kind of comfy in there, but yeah, a little bit suffocating, a little bit dark. But it was very hard for me to tell everybody that I had a wife, and what was her name and stuff. It was a long journey, and I really want to thank everybody that stands in allyship and supports us in this process. And Alex for sure has been a big inspiration with his leadership. First met him putting up flyers in a queer people meeting psychedelics in 2010 in San Jose during the MAP Psychedelic Science Conference. I thought that was so weird, to like, what are these American people doing, creating the circles and creating space for people to feel safe. So I want to move into this topic of feeling safe. What is it that what kinds of help can we provide to queer and gender diverse people for them to feel safe, to create this work, to create safe spaces? what kinds of awareness or tips or recommendations do you have?
Well, there are microaggressions and subtle things that people say and do to me for being gay or for having really short hair. I think that confuses a lot of people. But I think the things that are really upsetting in the world right now are like trans people being killed, people in other countries being killed for being gay, like for people to be allies, to express their solidarity vocally, openly, like I really see the younger generation, since I'm now old, but like there's so much more supportive of other, gender expressions and sexual orientation, for people to vocally and obviously be an ally is I think the most important thing, because the whole thing about being gay is that you can disguise it if you really try, or at least you can disguise it so that people are afraid to ask. And allies should not be disguising that's not the way to go. It's to just be open about it, and for allies to also be open about it. And I think that also with psychedelics, it's like, don't just hide what you're doing. Like, of course you have to, because it's against the law, but like, if you can advocate for it, because the people who can have the privilege of speaking out, because they're not going to be killed for it or whatever, have an obligation to then speak out for it. That's how I feel.
Thanks, Clancy. Alex?
I just want to say, like, we're all halfway in and halfway out of this queer psychedelic closet. The closet is a social construction that we say the queer kids like grew up in, but actually, like, allies, we all built it together. You built it with us. We did it to ourselves in some instances. The world built the closet around the child from the outside in, and that poor kid, we asked them to come out of the closet, and to deconstruct that plank by plank, door by door, hinge by hinge. It's not their work, it's our work. It's what straight folks need to do. It's what cisgender folks need to do. That closet shouldn't have existed in the first place, and it's not the burden of the kid to come out to you or to talk with you about your gender, their gender. Like, help pull that plank off from the outside. And I think that there are rainbow skeletons in that closet for our community. It's not just MK Ultra. Like, this is a very dark history here. And in our clinical practices, I'm a clinical and research psychologist, so I'm going to get really specific and a little nerdy for a second, but let me just put out there, like obvious things, we can adopt best practices in terms of pronouns, names, when we do our clinical trials. When we talk about the generation and production of evidence, evidence-based practice, evidence-based treatment, we have to understand, like, well, who pays for that evidence? Like, how does that evidence funded? And frankly, there's really no, except for Clancy's work and a few other work, there's almost no, which is basically like a labor of love, no paid profit incentive to do LGBTQ affirming psychedelic practice work. It's just something that people do because they think it's the right thing to do. And so allies, I ask you to implement best practices. These have been articulated by the APA and SMART guidelines and other organizations. And I hope we can come out maybe with some of our own. That includes like assessing for gender and sexual identity, like in your trials. If you were to ask me today, do we know if psychedelic therapy, psilocybin therapy, MDMA therapy, ayahuasca therapy work for LGBTQIA folks? The answer is, we don't know. Literally, we do not know. We have these studies that say it works in the general population, but the cell size, the actual number of queer folks is so small that we don't know if it works for them, or if it works differently for them, or if the mechanisms of action and healing are somehow unique for people who have specific sexual identities or gender identities. And the reason we don't know is that we don't collect or capture the data. We don't write it into our protocols. We don't report the data. We don't standardize that across studies so that we can aggregate data and meta-analyses across multiple trials, so that we can just ask the basic question, does MDMA-assisted psychotherapy for PTSD work for gay kids or gay adults? And the answer is, we don't know, but we could know if we reform our practices. And it requires getting a little technical and nerdy, but I think that those are the things that we can do. And I think it's time. I think it's time to do it. So I'm totally inspired by the people who are like taking the extra step. Oftentimes, at cost to themselves as allies to make this work better. And I really appreciate that.
So I think, whatever you want to say in terms of how can we support people in this process? What can we do for queer people to help them feel safe and have these experiences? But what also can allies, non-queer people, do to support this? Either or both.
Well, uh, to help someone like me in this, as a queer person that's in the underground and has to like duck and hide a bit, because visibility is like, it's like, it could be a little bit of a double-edged sword, you know. I think in all that we're doing to make sure that things go through at the clinical level, we need to be making sure that things go through for the level where of people that do the work that I do. Because the work that I do may never become like the clinical model, and the clinical model may never become like what it is that I do, and that's okay, because people are different, and we all need different areas to different spaces to receive our deepest and best healing. But the part where someone like me can end up in jail for spreading information that spores are legal and so are grow kits, the part where I can go to jail for talking about the facilitator heroic dose as opposed to the general public heroic dose, this is what needs to change in our world. And so allies can really speak up, not just for our BIPOC clinical folk, but for the people who are doing this work in the underground. Because there's information here that if many of us get locked up for, this is a whole library of information lost that our red tape in the clinical trials and so on, it has not yet uncovered, and it will not uncover for years to come.
All right, people, we're coming to an end. I do want to remark that, sitting on a panel in this kind of pandemic transitioning world on our virtual spaces is not the best and ideal way. So I really thank all of you for being participant and bearing with us. We do hope that as queer people also we can bring the mix of party and celebration and love and dancing and fun and things that we can hardly do these days through the screen. I think that's something we just have to say for the records, that this is just the formal part of it, but all our gatherings have the informal fun part of it, and the healing in that is huge, and more than just the blah blah that we bring to the table. It's this creativity and this fun that can be the queer spaces, the best parties, everybody knows, for one thing, is a fact. And so maybe we can just start dreaming of a time that we can get together again and, be together in person and celebrate our identity, our pride, feeling love for who we are and not shame, and killing those monsters and ghosts of homophobia, transphobia that do still hunt all of us, always. And so I'm very grateful for this opportunity. Want to say, pass the word to everybody to end, and see if you want to say, if you're in Instagram or whatever, you can be found, give your handles, and if you have any final comment. And then maybe I hope Kevon will share some of his poetry, saying in the very end, if you want to. Kevon has multiple tricks, so maybe you want to share some of that as a departure. So it's going to have Clancy, Alex, and Grand Final. Kevon, if you want to share anything with us to bring us back from our virtual gathering to the rest of our lives. So Clancy.
Yes. Well, my work is mostly at Chacruna, so you can. My email is clancy@chacruna.net, and I just want to say thank you very much to everybody for supporting this, and it's great to see you guys again. And I'm glad that this is in June too for Pride, and I think we're going to have some kind of Pride in San Francisco. But anyway, I hope people appreciate the month. Thank you for the opportunity.
Thanks, everybody. I also just want to say, since we're celebrating this June 20th World Psychedelics Day event, I just want to say, like, we've learned so much from our queer teachers and our psychedelic teachers and our queer psychedelic teachers, but also, like, I want to invite and challenge anyone who's watching this to, like, step up. Like, you don't have to be ready. Like, you're never going to be ready to do whatever you might need to do. And there's a huge amount of terrible homophobic, transphobic happenings in the world on World Psychedelics Day. And I honestly believe that psychedelic medicine can be not just a general, but a very specific source of healing. I've seen this in multiple patients now. And I work in this sort of client-patient model, but I think there are ways for these medicines to heal us collectively, potentially, if we do this well together. And it doesn't happen without you. And so, like, raise your hand, stand up, like, organize the event. And especially in sort of queer community circles, I really think that we could use that. And I know that I benefit from it. So that's my invitation. Thanks for everybody for listening, and I wish you a happy Pride.
So I've disconnected my headphones, so maybe you can hear me clearer now. But I may not be able to hear you as clearly. So that was a challenge. I wanted to hear you clearly. And I'm going to grab an instrument. One's right next to me. Yay! Now I gotta go far. And just offer the sound of this flute to all who will be watching in the future and all who are watching now. The moment has come upon us to be here together in this flow we call now. I know there are many steps in the journey, but each journey begins with a single one. Don't worry about how. And as we move our way through all of that sticky red tape, don't worry, we're here, and now. We were never late, right on time with the star shine, right on time with the rainbow's climb. I'm yours and you are mine. Poem. Thank you, guys.
Happy Pride, everybody. Join us, Chacruna, on the 23rd if you want, celebrating 2 years of queer psychedelics. Follow us on chacruna.net, and much love from the Bay Area. Stay healthy and see you.
Hello, my name is Helen Loshny, founding board member of the Ketamine-Assisted Therapy Association of Canada.
And my name is Ray St. Arnaud, also a founding member.
Keta Canada was formed in 2019 in response to the growing need in the healthcare system to find interdisciplinary and team-based solutions to care, bringing professional disciplines together in the best interest of patients and clients.
Our health and wellness systems are siloed, and we are only beginning to understand at an institutional level the interconnectedness of the physical, mental, and social aspects of health.
So we decided we needed a cross-disciplinary conversation amongst all stakeholders, such as doctors, researchers, therapists, policymakers, and the community.
Bringing these worlds together in this emerging field requires a strong will for collaboration and a foundation of ethics and values.
We hope that you will join us in supporting all organizations and initiatives seeking to provide broad and safe access to this and many other life-transforming therapies.